Nifedipine detailed drug monograph. 1. Generic name, drug class, brand name, generic name, nifedipine, drug class, calcium channel blocker, CCB, subclass, dihydropyridine, primarily acts on vascular smooth muscle rather than cardiac conduction system. Brand names, Procardia, immediate release, Adalat CC, controlled release, Nifedical XL, Afetitab CR, Adalat retard, Europe, Asia. 2. Definition. Nifedipine is a vasodilator, antihypertensive, and anti-anginal agent. It works by blocking calcium influx into vascular smooth muscle cells, leading to relaxation of blood vessels. This lowers blood pressure and improves oxygen delivery to the heart. It is commonly prescribed for hypertension, angina pectoris, and certain vascular conditions, e.g., Raynaud's phenomenon. Number 3. Mechanism of action. Normal physiology, calcium ions enter vascular smooth muscle and myocardial cells through L-type calcium channels. This calcium influx triggers contraction. Nifedipine effect. Inhibits L-type calcium channels, reduces intracellular calcium, vasodilation. Stronger effect on arterial smooth muscle than on myocardium. Decreases systemic vascular resistance after load, lowers blood pressure. Dilates coronary arteries, increases myocardial oxygen supply. Key difference: unlike non-dihydropyridine CCBs, verapamil, diltiazem, nifedipine has minimal effect on heart rate and conduction, so it's mainly a vascular drug. Number 4. Uses, therapeutic applications. Primary approved uses: hypertension, chronic management, chronic stable angina, vasospastic, Prinzmetal's angina. Off-label uses: Raynaud's phenomenon, preterm labor, tocolysis, relaxes uterine smooth muscle, high-altitude pulmonary edema prevention, hypertensive emergency in pregnancy with caution. 5. Indications: first-line or adjunct therapy for essential hypertension, prevention and treatment of angina attacks, relief of coronary artery spasm in Prinzmetal's angina. 6. Contraindications: hypersensitivity to nifedipine or other dihydropyridines. Severe aortic stenosis can worsen obstruction and collapse. Cardiogenic shock or severe heart failure, risk of hypotension. Acute myocardial infarction within the last 1 to 2 weeks, concomitant use with rifampin, induces metabolism, ineffective. Number 7. Before taking this medicine, precautions. Cardiovascular disease, caution in patients with heart failure, hypotension, or arrhythmias. Liver disease, metabolism occurs in the liver, dose adjustment needed. Pregnancy, category C, sometimes used for preterm labor, but with close monitoring. Breastfeeding, excreted in breast milk, use only if clearly needed. Elderly patients, more sensitive to hypotension. Drug interactions, avoid grapefruit juice, raises nifedipine blood levels, toxicity. 8. How to use. Take orally at the same time daily. Extended release tablets should be swallowed whole. Do not crush, chew, or split. May be taken with or without food. Continue taking even if you feel well. BP angina may not cause symptoms. Do not stop suddenly, can trigger rebound hypertension or angina. Number 9. Dosing information. Adults. Hypertension. Extended release. Initial 30 to 60 milligrams once daily. Maintenance 30 to 90 milligrams once daily. Maximum 120 milligrams per day. Angina. Extended release. Initial 30 to 60 milligrams once daily. Maintenance 30 to 90 milligrams once daily. Maximum 120 milligrams per day. Immediate release, rarely used now, 10 to 30 milligrams every 6 to 8 hours, not recommended due to risk of rebound ischemia. Special populations: elderly or hepatic impairment, start at lowest effective dose. Children, limited data, specialist consultation required. Number 10. Miss a dose, overdose. Miss a dose, take as soon as you remember. If close to the next dose, skip the missed one. Never double dose. Overdose symptoms: severe hypotension, shock, dizziness, fainting, rapid or irregular heartbeats, confusion, possible cardiac arrest. Immediate emergency care needed. Number 11. Stop or avoid taking. Never stop suddenly, may worsen angina or cause hypertensive crisis. Avoid alcohol, worsens dizziness and hypotension. Avoid grapefruit juice, increases drug levels, risk of toxicity. Stop if severe allergic reaction or intolerable side effects occur, with doctor's advice. Number 12. Side effects common: headache from vasodilation, flushing, dizziness or lightheadedness, peripheral edema, ankle leg swelling, palpitations or reflex tachycardia, fatigue. Less common: nausea, constipation, gingival hyperplasia, gum swelling, hypotension. Serious, medical attention required. Severe hypotension or fainting. Worsening chest pain or myocardial infarction, rare, mostly with short-acting forms. Arrhythmias, allergic reactions, rash, swelling, breathing difficulty. Number 13, vital information. Nursing clinical monitoring. Monitor blood pressure and heart rate regularly. Check for peripheral edema, common adverse effect. Advise patient to change position slowly, orthostatic hypotension risk. Reinforce adherence. Skipping doses may worsen condition. Watch for drug interactions, especially CYP3A4 drugs. 14. Other drugs that will affect nifedipine. CYP3A4 inhibitors, increased levels toxicity. Ketoconazole, itraconazole, macrolide antibiotics, erythromycin, clarithromycin. Protease inhibitors, ritonavir, indinavir, grapefruit juice. CYP3A4 inducers decrease effect. Rifampin, contraindicated. Phenytoin, carbamazepine, St. John's wort. Other cardiovascular drugs, beta blockers, risk of hypotension, heart failure. Digoxin, nifedipine may increase digoxin levels. Other antihypertensives, additive BP lowering. Magnesium sulfate IV, increased risk of profound hypotension, especially in obstetrics. Thank you. Have a nice day.